Dr. Rachana Kulkarni, thank you so much for giving us your time on ITV Gold. Again, thank you for being with us here today.
My pleasure, Aditi.
Of course, we have you because February is American Heart Month and you're one of the most known cardiologists in the area. So today we have you on the show to discuss something different, which is how to maintain a good heart health. How do we really raise this awareness? So let's start this interview asking number one question that everybody has, doctor. Why are heart diseases the number one killer in this country?
Great question, Aditi. Heart disease is, I consider it as a disease of affluence because heart disease happens because of a lot of risk factors. Risk factors are conditions that predispose us or increase our risk to develop heart attacks and heart diseases. And those are, we qualify them into two categories. One is modifiable, and another one is non modifiable. Modifiable are risk factors that we can do something about. And non modifiable risk factors are that don't have any control, such as age, sex, ethnicity, and very important is our family history. If we have people in our family who have had heart disease, then we are inherently genetically more predisposed to have those. And then there are non-modifiable, these are the non-modifiable, and then we have modifiable risk factors, and they are high blood pressure, diabetes, high cholesterol, stress, and smoking, and activity or sedentary lifestyle. So these factors are very prevalent in Americans because now with affluence, with all modernization and most jobs being desk jobs, the level of activity has gone down. And we are fortunate enough that we live in a country of abundance.
Right.
So there is abundance food. With that comes high cholesterol. With that comes increased waistline, diabetes, hypertension. These are all unintended consequences of affluence and us going with that and not compensating that with physical activity. And that's why heart disease is the number one killer in the United States.
And doctor, a lot of these comorbidities that you just discussed, South Asians actually have them a lot. I'd like to know what is the reason behind that? Why is there so much high cholesterol, danger of heart disease and diabetes and so on and so forth? Why is it with our population?
Excellent question, Kane. Heart disease is very, very prevalent in the South Asian community. I'll give you, and it's prevalent and it also is quite aggressive. What I mean by that is that cardiovascular disease, heart disease, presents 10 years younger as compared to other ethnicities in Indians or South Asians. The deaths due to heart disease occur 5 to 10 years earlier in South Asians. 12 to 16% young Indians will have heart disease. So we are considered the highest of any ethnic groups in the world to have heart disease. And number of life years lost in South Asian community are just tremendous. And I'll give you some statistics. In 1990, 5.6 million men and 4.5 million women succumb to heart disease.
Wow.
And we are very uniquely predisposed because of the clinical South Asian phenotype, which we can go into later. But those are some of the reasons. It's very prevalent, it's very aggressive, and the outcomes are not as good.
Right. When you're looking at heart diseases, doctor, would you agree that heart attack is probably one of the most common heart diseases that we see? But what do you see as the most common heart diseases?
It is heart attack, or what we call as coronary artery disease, is the most common of all the heart diseases, which is blockages that form in the blood vessel that supply the heart itself. So that is the most common. The second most common is congestive heart failure. That is usually an after effect of heart blockages. So those are the very common heart diseases that we see.
Right. Let's go into these diseases because I have a lot of questions regarding heart attacks as they are so common, especially amongst South Asians as well. How can you assess if your heart health is not good? We've been reading that there are signs that you see before you have a heart attack, perhaps, where your heart, health is sort of failing. How can we assess that?
Excellent question. You did your homework on this. So there are two ways to look at this. One is know your numbers. What I mean by that is, just I had mentioned before that there are some predisposing factors: high blood pressure, high cholesterol, diabetes. These three are called silent killers. The reason is that they don't give you any symptoms, but they will affect the cardiovascular system and even the stroke, which is we can easily qualify as heart disease of the brain or heart attack of the brain, stroke attack. So those are the risk factors, which are silent killers, meaning that we don't have any symptoms because of that. So how would we know? Know your numbers, know your blood pressure, know your cholesterol, know your blood sugars. And that can be facilitated by regular visits to a doctor. So let's get out of the habit of going to doctors only when we are sick, because prevention is the key.
Right.
And I have been involved with American Heart Association. I'm fortunate enough to be the president of American Heart Association for the state of New Jersey. And what I can tell you, research has shown that most of the heart attacks, most of the heart disease, 80% of that is preventable if we identify and address risk factors. And that's why knowing your numbers is important. Taking good care of your heart health preventively is important so that you can prevent damage to the heart muscle and you can increase your longevity.
What age groups do you see heart attacks and the heart disease is most prevalent at? And a follow-up question to that, could a 33-year-old, somebody who's young, a young youth, could that person have a heart attack?
So typically, heart disease is very prevalent in men in their fifth decade of life. So between 50 and 60 is the most common time. And for women, a decade later. And to answer your questions, can a 33-year-old have heart attack? It's unusual, but I have seen a fair share of it. And the etiology, meaning the reason, can be variable. A lot of times, substance abuse, especially cocaine, can cause spasm of coronary artery disease or coronary arteries leading to heart disease in young people. However, heart disease presents a decade early and is very aggressive in South Asians. And I have seen people with South Asian ethnicity presenting with heart attacks and cardiac arrests in their 30s as well.
Wow. What happens, doctor, when you have a heart attack? Could you tell us some signs that the audience can perhaps look at if that happens to them?
Sure. When you have a heart attack, what that means, the behind the scenes for a heart attack is that we have heart arteries that get blocked. When the blocking is gradual, after a certain amount, let's say when the artery gets blocked 70%, that compromises the amount of blood flow that goes to the heart muscle. And person, as soon as the demand goes up, such as exercising, walking, that person starts having chest discomfort. That's your heart's warning sign for you. That's in medical literature, we call it as angina. That's when your heart is telling you, I'm not getting enough blood, get me help. So angina is a symptom that we all should pay attention to. That builds up the typical characteristics of angina, and that probably can help our viewers differentiate between angina and other non-cardiac chest pains. We will have the person who has angina will have chest discomfort that builds up gradually. It comes on not as a sharp pain, but as a discomfort, pressure that builds up gradually and sometimes travels from the center of the chest to the left side, to the jaw, to the neck, sometimes to the back. People tend to break out into sweat. And it's a feeling of uneasiness. Sometimes people equate that to pressure or discomfort, having a toothache. So it's a nagging pain. Pain from heart disease is not sharp. People don't grab their chest usually. That is something that is shown in the movies, is a little deviation from the typical presentation. It's usually chest discomfort that builds on with certain activities or under immense stress and then dissipates after those factors are taken away, like dissipates after rest or removing yourself from a stressful situation.
Right. When you're looking at heart attacks, doctor, my research showed me that women have a different, way at on heart attacks. Women can experience mini heart attacks that they may not even know it's happening. Could you reflect on that? How is it so different from the heart attacks we see in men? And if if we could experience many heart attacks, like how do we take care of that?
Sure. So heart disease in women is a subject that's very close to my heart. I have made it my professional life's mission to raise awareness about heart disease in women because for decades it was a condition that was gone by the wayside because most women at multiple levels, at individual level, at societal level, at professional levels, heart disease was considered a disease of men. But the fact was far from the truth. And even now, today, in the United States and all over the world, more women die of heart disease than men. However, if we look at this now, women still consider breast cancer as their biggest threat. But the fact is, more women die of heart disease than all cancers combined. All cancers combined. So it's important for us to pay attention to that. And why do women miss it? Because a lot of times symptoms for heart disease in women are atypical. Instead of the chest discomfort that I described to you, symptoms are subtle. A lot of times women will present with shortness of breath as their main symptom. So shortness of breath on exertion during stressful situations. Sometimes intense fatigue, sometimes just back pain. So these are atypical symptoms, and a lot of women will write it off as just being overworked, or I have just gained weight, I'm out of shape. And so they ignore it. They don't seek medical attention. Even when they seek medical attention, it's possible because medical students and budding doctors are not taught about differences in heart disease in men and women. They also can chalk it up to just anxiety or something different. And as a result of that, there is delay in seeking help, there is delay in diagnosis, and it can be very costly because a lot more women die with first heart attack or they have out of hospital cardiac arrest as their first presenting symptoms because their symptoms got ignored by them, their family, and by their physicians. So it's important that we incorporate educating medical students and medical professionals about heart disease in women.
So this brings me to the $1 million question, doctor. How do we prevent these heart diseases from even happening? And if you have a history, a family history of that especially, how do you prevent it?
First important thing is know about your family history. Especially in certain cultures, and especially in South Asian cultures, uh, it is sometimes considered a taboo to talk about heart health and any health. Like, I certainly have relatives who would say there is nothing wrong with me. And I urge all of your listeners to use gatherings such as Diwali, Christmas, Thanksgiving, to know each other's health history as well. Because if you have heart disease in the family, then you should be very proactive about seeking help, identifying and managing your risk factors. If you have more than one risk factors, if you have family history, if you have high blood pressure, diabetes, high cholesterol, it's very reasonable to have a discussion about your heart health with your physicians and see if there are any tests that should be done to identify your specific risks.
Right. Doctor, you see so many patients that have heart diseases. You are a cardiologist. What's that one fact you wish all of these heart patients knew that's very, very important in maintaining a good heart health?
Know your numbers. That's one. And number two, very important, is pay attention to the science. Cholesterol is a very dangerous thing that is responsible for having heart disease. So know your cholesterol numbers and make a plan with your physician to address that and reduce that.
Can stress cause heart attacks?
Interesting question. Stress is definitely a contributing factor because stress can lead to high blood pressure. Stress can lead to elevated blood sugar. Stress can lead to stress eating, which can make our cholesterol worse. And sometimes stress can also lead to physical inactivity. But there is a unique condition which is called stress-induced cardiomyopathy, or an interesting name is broken heart syndrome. Very prevalent in women, but can happen in men. If women or if a person is undergoing a very stressful situation, death of a spouse, death of a loved one, sometimes divorce, or big something sudden happening, the heart gets shocked and presents like a massive heart attack. But when you look back and when you do all the appropriate testing, we realize that it's not coming from a blocked artery or a permanently weakened heart. The heart gets kind of temporarily paralyzed and broken. That, with appropriate treatment, that condition can resolve itself in 3 to 6 months. So it's called broken heart syndrome, very unique condition.
Wow. Especially with this COVID-19, we hope that the stress doesn't cause so much of heart issues. I just have 2 more questions left for you, doctor. What should, a heart patient be worried about with COVID-19? I know we've spoken about some correlations, how a person's case could go bad if they have these comorbidities. But what are you looking at right now with the COVID-19 and heart patients?
We have now identified that 10 to 15% of COVID patients will have some kind of heart manifestations. So first and foremost, if a person has weakened heart, congestive heart failure, or heart disease, the risk of adverse events or contracting COVID are higher than average population. Also, if a person has COVID, it's possible that they will have heart involvement, including irregular heart rhythms and sometimes intense inflammation and weakness of the heart muscle called myocarditis, which could be a very dangerous condition. So we have to be careful, and we have to try to avoid COVID if we can, especially when we have all these underlying conditions. And if you can get the vaccine, get it.
Well, my last question to you, actually, I would love for you to give a message to all the young adults in this country, because from what I've learned here is if you start early enough, your heart could be in a good condition. What's the message out for them?
You absolutely ace this question just because you're absolutely right that heart disease does not, when heart disease presents in the fifth decade, that means it's building up in your body from the second and third decade. So it's never too early to inculcate good habits. So please eat healthy, watch your cholesterol. If you're smoking, please quit. Please do not start smoking. That's the most modifiable risk factor, and that's one of the best things you can do for yourself. Drink alcohol in moderation and try to exercise 30 minutes, 5 days a week. If you do that, you can control and improve your heart health.
That's for sure. Well, thank you so much for your time here on ITV Gold. I learned a lot, and I'm sure the viewers also learned a lot.
Always a pleasure, Aditi. Thank you very much for having me.